Hello, my name is Jim VanderSteeg, and I just want to spend a few minutes with you. For some of you who will be watching this, it may be morning, it may be afternoon, it may be evening, it may be the weekend. And so I really want to start out just by saying thank you. Thank you for what you do every day. One of the things I wish I could do more in my role is meet all the employees who work so diligently every day. So this is an opportunity for me to say thank you. Also, obviously, we have something significant that's going on in our community right now. With coronavirus, COVID-19, haven't heard another name, but those are the two I've heard at this point in time. But obviously, if you look across our world, and then obviously into our own country, we have something to be concerned about. But I want to tell you this, because I want to talk about it, not worried about. Those are two different things, concerned. And so if you're watching what's going on, let's just talk for a moment about Knoxville, the surrounding areas. What you should be seeing is the numbers are very small, but they are starting to go up. If you look across the state, they continue to go up, especially in some of the areas like Nashville. I want you to know most of those patients are back at home. Most of those patients are not in hospitals. They're back at home recovering. And so I think we got to be really careful because everyone who's watching this, you are considered an expert. You are being asked by your neighbors, by your friends, what's going on and what are we doing? I think it's important to not be on either wrong end of the spectrum. What's one wrong end? One wrong end is, hey, this is nothing. No one should change their behavior. That is wrong. The other wrong end of it is this is the end of the world, and that is also not true. And so what are we doing at Covenant? Well, we're taking it very seriously. And I can tell you there are daily meetings that we get together as an entire system, and we go over what we're doing. And in between that, we're in meetings, whether you're the Chief Medical Officer, Dr. Brown, or you're me, or Mike Belbeck, or John Jeppe, or Luke Johnson. All of us daily are in meetings looking at how do we, as much as possible, be ahead of dealing with this virus. So I want you to know that. I also want you to know that there's a single source of truth that you can go to for Covenant, and that is our website. And on our website, you can pick up active information, as well as we will help you go to trusted sources of truth, such as the CDC's website, the Tennessee Department of Health. And this is something I really want to encourage you to be really careful about, because right now I have a family, I have a wife and 2 kids, and I am daily getting texts from them saying, hey, Dad, is this true? Hey, husband, is this true? And more what I'm finding out is they're getting information from friends, they're getting information from social media, and many times it's wrong. And so I want to encourage you to, as much as possible, stick to areas that we know are true. And those things that I mentioned to you are areas of truth. Like you, I am, as I said, I've got a wife and 2 kids, and so I do have concern. But I also know what we're doing as an organization, what we're doing as a community, what we're doing as a nation to try to keep this from growing too fast. The other thing, there's a lot of concern around this issue of why are we being asked to not be in big groups? And I'm sure by now you've heard the term social distancing, and that is a way for us to try to keep the disease itself from peaking too fast, and to try to keep it from overwhelming the health system. Again, you're going to hear things about California, New York, the disease, the virus has grown there significantly. One of the things that we're trying to do in this community is to slow down the growth of that. I will also tell you that we're trying to work together as a healthcare community. So it's not just Covenant. In fact, there's a call we have 3 times a week. It is the CEOs of all the health systems, and we get together and we talk about what we're working on. We're talking about decisions that we're making that we want to make together. We are going to stop doing non-essential procedures. And again, for more information on that, that'll be on the website. You'll get to see what are these procedures that right now the entire community is limiting. And by the way, it's not just health systems. It's the surgery centers and other organizations that have agreed that right now, let's limit these. Again, should that produce panic? No. Why are we doing it? We're doing it to protect our PPE, to make sure we're being very sensitive to not using it when we don't have to. So if we could limit those procedures, that's important. And then also just to kind of be another piece to help keep the spread of the virus down. So if you wonder what we're doing, what I want you to know is we are working really, really hard to prepare for a virus that, in all honesty, the news changes daily. So that's another reason I would ask you to stay fairly up to date. Again, going to the Covenant website, which can take you to some other places. So I want you to know that because I think it's really, really important. So trusted information is really, really important. And then I really want to finish with this. And I really kind of started off by saying, am I worried or am I concerned? And I am concerned. And I have significant concerns. And we all should, in terms of how do we protect ourselves, our family, our patients, and everybody that's around us. And so having actions of how we know we're going to do that. I'm not worried. And that is because I'm confident that we're going to get through this. And you say, well, please tell me why you're confident. Well, number one, I'm confident in God. I pray every day. And I know God has this. And so that's my number one confidence. My second one is the fact that we have a pledge. And we have a pledge that everybody who works at Covenant has signed. And that pledge says this: patients are first. And I've seen this pledge in action well before we were dealing with this. I had a chance on Monday to do some rounds in one of our organizations, and I got a chance to walk around and meet staff who are actually taking care of patients that they do not know at this point in time. We haven't gotten the results back to know whether they're positive or not. But here's what I saw in those staff. I saw compassion. I saw professionalism. I saw skill. I saw people that are willing to put a little bit of themselves aside for a moment to say, you know what, this is about the people we take care of. So at Covenant, patients are first, and it means something. Excellence. The fact that we're committed to giving our patients the very best care we can get them. Again, I see that in the past. We need it now. We need that from you. And then first and best choice. We want to be the place. And by the way, it is really, really important right now. The community, my guess is you have friends who are acting a little hysterical. What does the community need right now? The community needs to be able to count on Covenant and to count on you. I'm confident in you. I'm confident that this truly should be the finest hour of our organization and each of us as our community says, where do we go? Who can we trust? They can trust us because they can trust you. And I'll finish with this. So one of my favorite movies, and I want to be careful and not be Pollyannish about this. One of my favorite movies is the movie The Miracle on Ice. And for those of you who have watched that movie, my favorite line in that movie is when the USA is about to play Russia, and the truth is we should lose. But in that movie, there's a statement that's made, which is this is our time. And that's what I would say to you. If the community has ever needed us before, this is the hour, this is the moment that they need us. I'm confident because we have you. I'm confident that we're going to provide great care for our patients during this time because we have the greatest team in this market. So I want to again say to you, thank you. Thank you for caring about the right things. We'll continue to communicate to you. If you have questions, please ask your managers. Your managers, if they have questions that we have not answered at this point, we will continue to work to answer those. But I want to tell you so much I appreciate you. And we'll continue to keep you up to date on things that we're doing. But keep your head up. While the world is going crazy, they're counting on us to be the ones who are calm. And so again, thank you.